Uh, are we waiting for the participants to join? Yes, okay.
Yes, we're adding people to the room now. Thank you very much to everyone that's joined the call so far. Let's give it another 3 minutes and we'll kick off. We're just waiting for one of our panelists, please. Hello, everyone. Good afternoon, good morning, good evening from wherever you're joining us. Guruji is now with us. Guruji, sir, can you hear us? Welcome back.
Namaste, namaste.
Namaste. Welcome to the call, sir.
I was using another computer, but somehow it is not working. Let's just see.
Stephen, can we start?
Yes, ma'am. We're starting now. All right. Let's get right into the call. Thank you to everyone that has joined us. I would quickly hand over to Dr. Sapna Nurula, the President of Global Network for Sustainable Development, to give us an opening remark and welcome everyone to the call. Dr. Sapna?
Yes, I'm not able to hear you, Stephen. Can you repeat? What did you say?
Oh, can you hear me now?
Yeah.
Okay, I was saying that we're going to have an opening remark and a welcome address from Dr. Sapna, who is the President of the Global Network for Sustainable Development.
Okay. Okay.
You're welcome.
So, good morning, good evening to all of you. It is indeed a pleasure to be here and introducing this important. In fact, discussing with Stephen for the for this particular event, Stephen brought this idea and what are the constraints that we are facing in the administration of COVID-19 vaccine. So really important topic in the context of today, and it is also related to sustainable development goals, because we all want that equitable access of the vaccine to one and all across the world. So even when it comes to health access, we would like to see that no person is left behind. So youth can play an important role in the administration of vaccine, and their youth's voice matters and different cultural voice matters. As we all know that India has, is the forerunner in not only inventing the vaccine, rather, but also reaching out to various people. And as of today, our country has got around 1 crore people, they have been administered the vaccine, which is those who are at the forefront, who have led the battle against COVID-19 vaccine. This is an important issue for all of us. So those people who come from medical community, medical researchers, they were working throughout to make this happen. So let me also introduce my team and Global Network for Sustainable Development. Global Network for Sustainable Development is, is a global network where we reach out, engage with the youth, and it is the youth's voice for sustainable development. We work on sustainable development goals. We have our network spread across 13 countries. Of course, we have moved forward, but still a lot of work to be done. We have to work more in this area, and 2021 is the year when we are looking forward to work in this area. So to start with, let me also apprise you of some of our activities. In the last few months, we have made 3 MOUs, one with Gandhi Research Foundation, another with Connecting Dreams Foundation, and the third one is Equicap Asia. So these MOUs has helped us, move forward, take tiny steps forward in this direction. More number of volunteers have joined the team, and we have an executive council team. You can meet our members here. Ashima Mathur, she is the vice president. My colleague Stephen, who is executive team member and looks after our global expert repository project. Shweta Mathur, who is Shweta Asthana, who is looking after the social media, and she's reaching out to youth with her, social media strategies. So as you can see that this network, I'm only the honorary person. In fact, there is a young team behind it, and they don't, they have the baton in their hand. This is what I call them. And we have also started collaborating with other organizations for various projects, one of which is Youth for Sustainable Development. Second is Change Maker Lab project. So you can find more details about it on the website. And with these words, I would like to welcome all the esteemed speakers who have joined from various countries. There is a diverse team of speakers and an important topic. So I don't want to come in between you. I wish you all the best. And I'm sure that the discussions that we will have bring out some meaningful outcomes, and a policy brief is expected after the discussion that we will circulate to various comments. So over to you, Stephen. Thank you.
Thank you very, very much, Dr. Sapna, for that warm welcome. And once again, I welcome you all. No one with absolute certainty could predict the impact that COVID-19 would have on the world when it first came out 2 years ago. It has taken a toll on the mental health of people, caused economic devastation, with so many businesses around the world packing up. We have all been affected one way or the other, as individuals, as families, as businesses. Everyone here has been affected by the pandemic. And we've prayed so long for vaccines to come, and now vaccines are in production, and some have already been administered to people. But some myths and doubts surrounds the conversation around COVID vaccine. And today on this call, we are glad to have 5 amazing people to help us shape our thoughts around the subject of COVID vaccine. Each panelist will be given 5 minutes to share an opening thought, after which there will be some questions from myself to each of the panel members, and then we'll open it up to the audience for questioning. Let me quickly introduce the panel members that we have with us today. In no particular order, I will read out their profile. We have with us here today Dr. Martins Balaba from Uganda. Dr. Martins is a medical doctor, health innovation enthusiast, and entrepreneur with unwavering passion and enthusiasm to work on healthcare challenges that sets new trends and changes overall paradigms. He has over 5 years experience in the digital health and mobile health sector and has built feasible solutions that addresses equitable access and inclusive healthcare systems. He's currently working on projects to explore opportunities for artificial intelligence, drones, big data, and blockchain related to the health sectors. Throughout his career, he has successfully provided strong and effective leadership and directions to team members to provide innovative solutions to complex issues. He is known for his agility, ability to succeed in an environment where decision-making, self-motivation, integrity, and excellent communication skills are held at a premium. Thank you very much, Dr. Martins, for joining us. You're welcome to the call. Next on the list is Miss Khadija Amaha. She's a master's graduate of applied linguistics and English language teaching. She's currently taking the role of the operations director for an accelerator program that aims to accelerate actions inside World Merit Council, which is a youth-led directed organization. Thanks to her passion for public speaking and cultural exchange, she joined Erasmus Virtual Exchange in 2018 as a team lead. Few months later, after receiving training.
Yeah.
So sorry about that. I don't know what happened to the network there. So I'll continue with Ms. Amaha's profile. She focuses on bridging the gap between culture and enables people become better communicator, critical thinkers, and tolerance of others, irrespective of our differences. Welcome to the call, Khadija. Thank you for joining us. Next, we have Guruji Dilip Kumar. Guruji is a world-renowned yogi and interfaith minister from Kerala in India. He is an interfaith family. His interfaith family is ancient and well respected for his Vedic knowledge of yoga, Vedanta, universal spirituality, and the origin of martial arts. He wears different hats, among which are global servant, universalist, humanitarian, spiritual guru, interfaith minister, yoga master, global monk, and is currently the representative for NGOs at the United Nations. Thank you very much for joining us, sir, and welcome to the call. Next, we have Dr. Garima Poddar from India. She's a senior consultant in the Delta Department of Shanti Memorial Super Specialist Hospital. She's also a faculty member with a diploma in endodontics program from Italy, from Spain, I mean. She's a certified silver member of Style Italiano Endodontics and a key opinion leader when it comes to micro issues. She has delivered keynote lectures at many national and international platforms. Welcome to the call, Dr. Karima, and thank you for joining us. And last but not the least, we have Her Royal Highness, Regent Moyolua Falowo. She's a traditional head of the Ibele Soro Kingdom, a community situated in Ondo State, Nigeria. She holds a bachelor's degree in microbiology and currently a graduate student of virology at the University of Ibadan. Following the demise of her father in 2009, she took up the role of regency according to the traditions of her people and has championed many developmental projects in the interest of her people. She's skilled in advocacy, community development, conflict resolution, and is a true image for young and inspiring leaders. Thank you very much to all our panelists, and we are so glad to have you all on the call. So we'll go quickly and have an opening thoughts from each person, 5 minutes each. And I will start with Dr. Martins. Dr. Martins, over to you. We can't hear you, Dr. Martins. Uh-oh, I think something is wrong with the audio. We can't hear you. While we wait for Dr. Martins to fix his audio, we can still hear you. While we wait for him to fix his audio, can we have the opening thoughts from Dr. Garima? Your opening thoughts, please, Dr. Garima.
Hello, everyone. And it is indeed a pleasure and an honor to be invited over here as one of the panelists. So, greetings from India. I'm Dr. Garima Poddar. So, this morning, when I last checked the number of coronavirus cases across the globe, the numbers were staggering, and they were 114,066,200 Although out of all these infected cases, 0.04% have been reported to be critical. But at the same time, the best evidence in favor of this vaccine has been that all of them, those who have taken the vaccine, have shown 100% protection against hospitalization or death. So, there are now several vaccines that are in use, and there are basically 3 platforms of different types of vaccines. And first, the mass vaccine program was started at about 31st of December, late December. And now, in about 7 different, 7 different players are there which are trying to provide vaccination to the entire world. And slowly, about 200 more companies, more brands are, working on the vaccines to make it available to every person across the globe. As far as personal experience is concerned, me and my husband, we both have been COVID warriors. We have been serving in COVID hospitals, in hospitals where COVID patients have been treated during the pandemic, and we have seen the scenario up front close in front of our eyes. So I really feel that, although without the vaccine coming into picture also, there has been decline in the number of cases. We could think it could be due to the herd immunity, etc. But as of now, we do not understand this virus completely. So I really feel that we should take each and every measure which could be possible to break this chain, to get this pandemic under control. And I think it is high time that we need to restart the world. So I have personally taken both the doses of vaccine right now, and I am really in favor, and I would encourage and support this vaccination drive. Thank you so much.
Thank you very much, Dr. Garima, for sticking to your time. And good to know that you've taken the COVID vaccine. Let me now shift to Dr. Martin. Let's try Dr. Martin again and see if we can hear you. Dr. Martin?
My sound clear now?
Very good. We can hear you clearly. Go ahead, please.
All right, thank you so much. Apologies for the mishap. I'm Dr. Martin Walaba, and I work with the Innovations Academy at the Institute has been at the center of responding to the COVID outbreak in Uganda through capacity building, the different facets of the response. My core work in the response has been building capacity in leveraging innovations and technologies in potentiating the response by the different implementing partners. The response initially took identifying gaps where there were loopholes into possibilities of increasing community spread within Uganda. And given our previous experience with outbreaks like Ebola, the government acted quickly to close some of these loopholes, like the airport, even before we identified cases within the country. And Ugandans have experienced, like I said, with outbreaks. And so community participation initially was really high in terms of behavioral change and working with the ministry to spread the message regarding the standard operating procedures. So along the way, the landscape of the response changed from the different aspects as when we identified the cases, and then we had different streams that were giving us more community spread, like truck drivers, the borders, which was still bringing goods because it had to sustain the economy. And then, of course, during this time, the country was in a lockdown. Significant is the fact that we also experienced the global spread of fake news regarding the pandemic, the disease, the response. And that has been a global song because of politicians communicating than the scientists. And so that kind of created a mismatch within the communication because they're not authorities in science. But when politicians communicate things and scientists are not backing them up, it always creates a discrepancy. However, now the conversation has changed into the vaccine. And from my understanding and experience with this is there's quite a lot of unfairness. We all know that vaccines are critical in making sure that we get the pandemic under control. But the sad story, that the sad reality is we're seeing that the advocating for equitable health as is for the sustainable development goals. So this has exposed a great, gap in commitment to making sure there's equitable health, because the big powers or the big countries that have a large capital base, you will see that they have ordered for vaccines, even pre-production, that can vaccinate ×5 their populations. So much as we sign all these agreements and understandings, in a conversation like this where we're demystifying issues regarding the vaccines, access should also be very critical. So I was having a conversation with Stephen to see if we could actually have had someone from the big pharma or big implementing partners in the vaccination drive, because when the vaccine is not available, especially in the middle and low income countries where a lot of fake news is going about from the pandemic to the vaccine, you realize that the more it is being hoarded by the big nations or people who have access to more capital than other countries, it creates, already these countries are facing critical issues economically and otherwise, and healthcare systems are already challenged. So access to vaccines for me is number one priority. As we demystify and access is made possible for these countries, it makes the campaign of the demystification easier, because more people will be engaging in getting the vaccine, coupled with the communication that is scientifically guided to demystify any issues regarding the vaccine. But the more it gets hoarded by people who have more capital, it creates that tension and then opportunity for conspiracy. So access is very critical, and then having scientifically guided communication regarding the vaccine. It is not chipped, it doesn't have any tracking issues, is very critical. Those who were born in my settings in the early 90s, we realized that polio was a very big killer. I witnessed key members of my family almost consumed by immunizable diseases. And the same issue came up about vaccines when they're rolling out the polio vaccine. But community engagement was key in creating a very scientifically guided communication. And those community built structures up to now have been key in creating that response within communities regarding control of COVID in our midst and other pandemics. That's how we control Ebola and Marburg. So we have well-built structures from community to top. And for us, that community engagement is key in responding to any emergency. But we need to make sure we hold accountable people who are supposed to make access to vaccines. We need to make them accountable, because it is now key that for economies to open up and create safety, we need to have the vaccines. So that is my take. That's my opening remark.
Thank you very, very much, Dr. Martins, for that honest feedback and advocating for equal and fair access to the vaccine. I would now turn to Ms. Khadija for opening remarks. We can't hear you, Ms. Khadija. We can't hear you.
Can you hear me?
Yeah. Yes.
Okay, cool. Thank you so much for having me with you here today. I really enjoyed the first from Morocco. And I would just like to remind you of a story that I lived when the pandemic first hit Morocco. We had 2 cases and many stories were circulated around. I was panicked. I was scared. I didn't know what COVID-19 was. And I was listening to many stories of people talking about the COVID-19 from different perspectives, and I was far away from home. And when I arrived home, I was scared that I would transmit the virus to my family members, which added another burden to me. But thankfully, that wasn't the case. I didn't have COVID-19, but many others did. However, the intervention of the Moroccan government with the leadership of our King Mohammed VI was very effective and efficient, because although we lost many lives, unfortunately, many more lives were saved. And that's thanks to the collaboration of all the society members. This pandemic has taught us how collaboration and solidarity between the different stakeholders in a community is important. The foundation, who studied about critical thinking and the importance of analyzing fake news from real news, is facing these doubts, let alone about people who consume fake news without the single doubt that that source of information is not credible. But my dad is healthy. He's doing really well. And I can't wait for him to receive the second dose. And something that Dr. Martin mentioned, which is related to social equality, is very important, because thinking about vaccine means saving lives, means that everybody after this stressful period of time deserves some peace of mind. And this also brings back the importance of joining efforts. I'll speak from my country. We have 37 million people, and this needs a huge amount of human resources to help in providing vaccine to everyone. And speaking globally, we have 8 billion people, and people from the medical field alone can't do it. They've already done so much. And it's up to us as the young generation, representing 40% of the world's population, according to the World Bank, to give support. And I really feel so happy when I see young people joining efforts to give support to provide vaccine to everyone. And in fact, I work with World Merit as the operations director of a global acceleration program. And one of the initiatives that World Merit is leading is called COVAX. And this initiative is in collaboration with UNICEF to create a network of volunteers worldwide who will support in providing vaccine to the community members. This experience of the whole pandemic should not leave deep scars in us, but should teach us lessons of tolerance, patience, solidarity, and how the pandemic has helped us to unveil many issues that exist in our societies, issues related to education, issues related to healthcare, to social equality among members, and also lessons about how the human being is really strong and how we can overcome many issues as long as we help each other and we support one another in the most toughest periods of time. I see that 5 minutes is up, so I'll stop.
Thank you very, very much, Khadija, for being observant of time and for sharing those amazing stories and encouraging the youths to join the effort in promoting the vaccine effort. I would now turn to Guruji for your kind thoughts and opening remarks, sir.
Namaste everyone. Loga samasta suina bhavantu. May peace prevail on earth. First of all, I want to thank Ashima Mathur, my friend from the UN group, and Daniel, inviting me to this event and spending time with my global family. Previous speakers spoke very well about their experiences. Here, I want to mention something. During the Corona time, I traveled to India. When I reached airport in Kerala, it was really scary. I never went through this type of situation. And my health minister was really good. As a female, very active. Shaila is a teacher. and she did very well. It was a very controlled situation in Kerala. I escaped from the quarantine. Then I did so many events there, and I heard something going on really bad in North area. So I had to cancel all the programs, and I had to return back to New York. My sister came to my house, said, no, 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 Corona is going very bad. You may get trouble. Don't go back to America. I said, no, I am taking the flight early morning. Morning, I took the flight. Nobody in the airport. I'm the only person in the airport to catch the flight. It was very scary. No one is a very empty airport. We had around 60 or 80 people in the plane in the last moment. And we went to Abu Dhabi. It was a full flight. Still, I'm scared because so many people are there without any mask. Even I don't have a mask. I reached in New York, nobody there to check on me. This is a negligence I saw. I don't want to blame any government or any leaders, but America is supposed to lead the world. They're supposed to take care of people. I felt really bad about it. Then came to my home, I see nothing can happen. We cannot do anything. We stuck at home. Then first thing I said to my friends, we are going to call every single person around us. Collect everybody's phone number, start calling, make sure, are they hungry? Are they have enough food? Do they need any help? Those who need help, I call the city, arrange food for them. We did all the work. Maybe I spent more than few 100,000 people. I met, I walk with them. I wear my mask. I take natural medicines I brought from India. I eat 1 meal a day, 1 chai a day, maybe 1 or 2 hours I sleep. Online program with the people, non-stop until now. I took a challenge. Somebody is doing a foreplay with virus. I study in science. Even some of you don't know, I learned alternative medicine, so I know what is it. We believe food is the medicine, water is the medicine, thoughts are the medicine. Wonderful to have vaccines. Even I never took vaccines until I came to America. I was safe, but my dad was a doctor. So we have medicines. So even I make medicines. But we took it necessary. Yesterday, one of my one clergy friend called me and said, oh, we have 2 vaccines. One is Pfizer, one is Moderna. Which one you want? I said, I want to wait. UN and all the governments will come together, work together to eliminate this situation. This is not a new situation. Last some years, every year we have different viruses coming to the world. This is what I feel. So we have a responsibility to take care of ourselves. Those who know about medicines, which is good for people, let them know. Sometimes government won't allow us to take it. Natural medicine is good. Nothing wrong with it. You just Google it, you get it. Homeo, Ayurveda, Siddha, so many medicines in India. Or any other modern medicine also have a different. So we have our members around us. This is challenge. Peacefully, we have to face it. This is my humble request to everybody. Thank you.
Thank you very much, Guruji. Thank you very much for advocating for alternative medicine and sharing your meal plans with us. Thank you. Let me now turn to Her Royal Highness, last but not least, to share her opening thoughts and remarks. Your Majesty.
Good afternoon from here, from Nigeria. I celebrate everyone that has spoken before me. And when we talk about the vaccine, it's something we've all expected since last year that the pandemic became serious. But it's unfortunate that there are myths, there are misconceptions about the vaccine, something that we believe should be a lifesaver to the world. I know that it's unfortunate that number one, a lot of people do not even believe that the virus exists. A lot of people still doubt that we even still have coronavirus, that it's real, that it does infect people or that it kills people. Some people do not believe. So how do we want to introduce a vaccine to people that do not even believe that the virus exists in the first place? Then number two, we have people, especially in Africa, yeah, people have lost faith in government. So we are, for example, in Nigeria here, we are expecting our government to procure the vaccines and channel the ways that it will be distributed. But a lot of people have lost faith in government. So some people even be scared that, okay, I hope they don't bring fake vaccines and start injecting all of us, because a lot of people are worried. Some are even worried about the production. What if we take the vaccine and it causes infertility? It causes problems for us. It changes our genetic system and all that. Then we have people that have lost faith in the private sector, in the pharmaceutical industry. A lot of people do not even have faith in the pharmaceutical sector. Some people believe it's just a way to make money, that some people just invented the virus in order to profit. So we have a lot to contend with among people, not just in Africa alone, but all over the world. It would amaze you to find out that even in America, which is believed to be one of the most enlightened societies, some still do not believe in the vaccine. And we are discussing the vaccine and the myths, the misconception, and there is need for our people to be more relaxed. We need the governments of the world, as Ella stated, the governments of the world, the United Nations, all those companies that produce it, to further educate our people. As a community leader, I'm a community leader, so I speak from the perspective of people that believe and people that are very skeptical about the vaccine. There are people that believe, maybe from the point of experience, literacy, education, and all that. Why some do not even believe in the vaccine? So we need to reorientate our people. We need the governments of the world to further make people trust them, that this is for your good. We are doing this for your good. And this is something that is going to benefit the health of all of us. Then we need the consistency of the government. Then we need ourselves to teach one another, just the way we are doing. We need our people who believe in the vaccine to go out there and put faith and trust in the hearts of people, so that when those that are here to get it, we go out there to get it, and the countries that are here to procure these vaccines will be willing to have their people receive it when it eventually gets to them. Thank you.
Thank you very much, Your Majesty, for that reflection. I know, Khadija, you need to be at another meeting shortly, so I will start my question with you, Khadija. How can the young people on this call today join the COVAS group and promote the work that COVAS is doing to spread the vaccine across the world? And secondly, to Khadija, how can young people, aside joining COVAX, participate more in being ambassadors for people to take vaccine? Would you encourage young people to be ambassadors for others to take vaccine? Yes or no, first of all? And if you say yes, how can they do that? And if you say no, why not?
I'm
Khadija?
sorry to interrupt you. Can you repeat the first question? Because
Oh, so the first question is, how can young people
yeah,
join the
can you please
COVAX
repeat the
group?
question?
Can you hear me now?
Yeah, so
So I was saying,
yeah, I can hear
how
you.
can young people join COVAX, to help promote the efforts you're doing as young people? How can we join COVAX, the Global Vaccine Group? And then how do young people be ambassadors for others to take the vaccine if you support the vaccine? And if you do not support the vaccine, why not?
So I will answer the first question. It's a quick procedure. You can just go to the website, World Merit's website, and there on the front page you'll see COVAX, and you can just click on it on sign up to be added to the list of volunteers, and the team will follow up with you to help you and to share with you how you can join the effort and volunteer for the COVAX project. And for the second question is how young people can be ambassadors supporting the vaccine. Is first of all, I think education is very important. And instead of waiting for others to be educated and to convince them, we should educate ourselves first. Why this vaccine is important and how it can save lives, and what scientific research can we use as young people to convince others. So by educating ourselves and by having enough strong arguments to convince others, we can be ambassadors to support the vaccination and being the model. We cannot expect other people to join our efforts, and let's take the example of not throwing trash in the street. How can other people follow you if you yourself are throwing trash in the street? And the same thing applies to vaccine. By being the model, by being accustomed and used to that field of knowledge, you can be an ambassador. And starting small, let's not always be too ambitious by trying to start big. Let's start with ourselves, our small community, family members, friends, community again, and then we can spread the word. It's just like a snowball effect. You start very small and then the ball keeps growing until the effect of it is wider. I hope that answers your question.
Thank you very much, Khadija. I will now turn to Dr. Martins. Dr. Martins, we have a representative here to the UN with us, and we also have some politicians in our network. So these two questions are to you in light of that. How do we ensure fairness in access of the vaccine for countries in Africa and Asia that don't have large capital, as you've alluded to? And number two, how do you get governments, especially in African countries, who are more inclined to their political careers, to believe in scientists? Dr. Martins.
Stephen, thank you for the questions. I think it would be nice for the politicians to answer for themselves, but I don't know how to answer for them. But from a medical perspective, quite a number of programs are signed by many member states, but when it comes to implementation, it becomes very dodgy, and there's no accountability to commitment. What COVID has also shown us is, in relation to the question you've asked, is we need to approach globalization carefully, because every community and country has tried to find solutions within themselves to respond to the pandemic, and you would see that nations became more divided than united. And so the issue of COVAX being a universally signed agreement for access to the vaccine has become dodgy, because even after signing the agreement, most European countries ordered for more vaccine than other countries. So we need to be more practical and be intentional when we come to have these global conversations, and we need to implement that which we signed into, because to this moment you can't explain that the UK has five times the number of vaccines needed for complete coverage of the entire nation, 2 doses, yeah? And these 2 doses are beyond just one type of vaccine. So how about the other doses of other vaccines which have been passed as viable to contain the pandemic? So I think the implementation of these agreements need to be more realistic and more practical. But then again, it is sad that we're having these conversations where governments in our settings in Asia and Africa are quite selfish and are not people-centric, because we should not be at a point of begging for a vaccine without building internal capacity to do our rigorous research as African nations and Asian nations, or building more internal capacity to respond to global health emergencies like this. We should be more intentional with all this donor money and World Bank and all these big agencies. We should shift the mentality of dependency, but build internal capacity to make sure countries have the ability from rigorous and basic life science research, where they can also be at the forefront of developing their own vaccine without waiting for the global north to come up with things which are now tested in clinical trials in different populations. So building capacity is going to be key in the next pandemic. So if governments don't shift their attention to building internal capacity, scientific research, and setting up structures that can respond to these emergencies, you will find that nations which don't have that infrastructure will be more marginalized than what COVID has exposed. So this has been a wake-up call for us to invest in our own internal resources, our own doctors, create those facilities that can enable us to build core and anchored response systems, both in implementing guidelines, in implementing scientific research. And for me, that is going to be key. So from the global perspective, we need to be more realistic in implementation. We had with the polio vaccination, creating equitable access to vaccines. And so we need to hold the leaders accountable who signed this agreement, because President Kagame recently pointed out the hypocrisy in the European Union, who have denied access to the African countries who signed into COVAX, because the companies supplying COVAX are the very company were funded initially for the research by these big European countries. And so once the vaccine was out, they had the first mandate to hold the patent and the distribution, which is very unfair. So we need also public access to this documentation should be made more available to understand what has gone into these agreements that we are signing into. You know, what have we agreed upon regarding access to the patents of these vaccines and drugs? You know, so because when COVID came and everyone was rushing to invest, you know, be at the mercy of those who have the capacity to finance the research and the vaccine. So nothing was available to the public regarding access to the patents, and then the distribution changed once the vaccine was available. And that's why you will find that in Uganda, we are going to be procuring the vaccine at $17, which is close to 5 times the $3 in Europe and South Africa and Kenya. So things like that will create, if you don't have a universal implementation agreement, it's going to facilitate the already worsening corruption within our systems, because you haven't created that accountability from what you've signed into and made it publicly accessible. So people always take advantage. And so within our already cracked systems, people take advantage of the cracks from the top. So the bottom person will have to pay more to access the vaccine. So we need to align all those structures to make sure that the next pandemic we have the internal capacity, but then from the global perspective, we are intentional on implementing what we sign into.
Thank you very much, Dr. Martins. That's
That's my submission.
That's a very, very lovely submission. And I'm sure our politicians and our rep at the UN are taking notes to convey a message and to be included in the policy brief, like Dr. Sapna mentioned. Let me go to Dr. Garima. Dr. Garima, you've been able to get your 2 doses of the vaccine. How safe is this vaccine for people who are scared that there might be possible side effects after taking the vaccine? And how easy was it for you to get these 2 doses? Was it because you're a medical doctor that you're able to get it? How easy was it for other people that are not in the medical field to access this vaccine? Dr. Garima?
So in our country, in my country, India, right now, the vaccination drive is kind of limited to the healthcare providers. And yes, because I have been, working in a COVID zone, and that is how we could, come first in the line. So healthcare providers are the front runners. So during the pandemic, entire pandemic, you can say we have been upfront, actually facing the virus when the vaccine was not there also. And now came the second part of the vaccination drive, where there are two parts going on. One is people are kind of doubting the vaccine. There are trust issues whether this vaccine is safe, whether this vaccine would work, whether is it just a gimmick or a money minting process or something, stuff like that. So I really feel honored, and I'm proud of my fellow healthcare providers that during the entire pandemic we have not thought about our health, and we have risked ourselves, and we were there to help the entire community, our fellow citizens. And when it came to vaccine also, because of healthcare this thing, there has been a bit of confusion and dilemma, and a bit of fear in the mind of healthcare providers also. Now slowly most of my colleagues have taken the vaccination, but yes, they were also skeptical about it. And from my side, what I did was, once I took the first dose, I made it public. I tried to educate so many of my colleagues that yes, I have taken the vaccine. Yes, there were slight side effects like a bit of headache, and I felt feverish for 1 or 2 days, but then it all subsided. And yes, I have been encouraging my fellow colleagues also to go for the vaccination. So I feel that now that all the healthcare providers in my country would one by one get vaccinated, and a lot of people, millions of healthcare providers have so far taken the vaccine. About 4.6 million people per day across the globe are getting vaccinated these days. So I feel that that is an encouraging number, and I think the numbers are increasing day by day. And yes, I definitely support that what Dr. Martin said, that there should be access for each and everyone. And we should now eliminate and keep aside the politics, and it should be accessible to everyone. But as far as my country goes, I think it is kind of streamlined, where now in the first week of March, the senior citizens and all those with comorbidities would be getting the vaccine. So I think it is kind of structured in a very nice manner, where healthcare providers who are the front runners and at highest risk got the vaccine, and then coming to 50 or 60 years of age above bracket, and then going to the youth. So I really feel that yes, there are a lot of trust issues, and trust me, during this entire 1 year of time span, even I have gone through a lot in my mind. Again, the trust issues, whether is it safe to wear a mask, is it sufficient to wear a mask. From that very point till the vaccine, everything has been question mark. Why? Because this virus is new. We are still finding each and every 15 days or 2 weeks, you could say, that we find something new about this virus. Yes, I understand that these could be gimmicks, like as Guruji explained that there could be. So I feel that I would kind of explain it in a way that we need to create barriers one by one. First barrier was wearing a mask and social distancing. Second barrier was following all the norms to prevent getting infected. Then came other barriers like the treatment or whatever. And then is our, the vaccine drive. So if I feel that we do not know this virus well. So I think we cannot actually take a risk now that we have seen that millions and millions of people have got infected, and so many deaths have happened, unfortunately. And really, economies, health, psychological aspect, everything has got affected due to this pandemic. And as I really feel that this is now time that we cannot take a chance. So first and foremost is definitely increasing your body immunity by getting into a good lifestyle, going into, taking all those immunity boosters, yoga, health, eating good food, taking the right choices, making the right choices. But at the same time, I really feel that for how long could a person be confined to four walls of your house? That has a very big psychological impact on a human being. So I really feel that yes, to break this chain of transmission and spread, even if 50% of the human population on this planet Earth could be vaccinated, maybe we would be successful in breaking this particular pandemic. So initially, I even used to feel that herd immunity is the answer. But then now that so many variants and mutants are coming in, now second question that maybe these variants are also a gimmick, or to instill a bit of fear in the minds of people to take vaccine, could be pharma company generated. But again, who knows? So if there are we really ready to take the risk? Because we do not have a definite answer exactly what happened, exactly how this virus is transmitted, exactly how this pandemic would stop. So I really feel that we need to take a collective effort. And I think all those barriers, starting from social distancing, increasing your immunity, taking up good lifestyle measures, and at the same time supporting the vaccine is the answer. So
Thank
thank
you.
you so much.
Thank you very much, Dr. Garima. Guruji, sir, my next question is to you, especially considering the fact that you interface with different religious bodies. How would you answer the question for people whose religion does not allow them to get vaccinated? What would be your advice to such persons?
The experience we are facing in New York City, some people from the Orthodox Jewish group, some Muslims, some people are so against the medical system. Doesn't matter whether Christians or Hindus, they all have this notion. No, we don't want to use at all. So certain times we had to use it. Like Dr. Harim already mentioned, the immunity is the main source for us to protect ourselves. She already said yoga. I am a yogi, and the food, proper food, vitamin C. Every day we need vitamin C. We need sunlight. You can have basil leaves. It has 36 medicine in it. You can have those. You can have ginger. Anything can digest faster, and your excretion should be properly done. You don't want to get psychological effect sitting in a room. So you have to be communicative with the people. Everything can happen. So that's why we do online programs, so we can bring people from different faith peak. People can ask questions. So the doctors will talk about different medical systems. So people get relaxed. That itself is a big medicine. We try to do different things to support our group. And this is a long process to get medicine for everyone for entire world. It will take so many months, maybe years. Even UN cannot mobilize that fast. Even we cannot find the root cause of this problem. And what about the general public? They cannot wait. They need help. That's the thing I look for. Okay, vaccine is there. Is that good for people? Because vaccine can affect each person differently. Same vaccine affect different ways. So it will take time to learn about, study about. So people have, of course, people have a fear about it. They don't want to mess up with their health. So let them have the modern system plus the natural system. We have an Ayush department in India. They talk about all of this stuff. You can go to Ayush Ministry of India. You can learn about it. So many doctors are there. Or abchomeo.com. Online, you can check it. Somebody wrote here, what medicines? I use Arsalb 30. 1 pellet in a day for 3 days. Every month I repeat. Vitamin C always. Only 1 meal a day because digestion will be properly done. And I walk every single day in the city, 60 to 100 blocks. I meet people, I give them mask, I carry. I got from the city, I carry and give to them and make sure they don't have any problems. Sometimes we don't know, even a touch can bring a virus. So we don't want to touch anywhere. So we have to be safe. Same time, we have to help our community because they have a right to live with us. That's why I care about people.
Thank you very much, Guruji, sir. And my last question would be to Her Royal Highness before I open it up to the audience. Your Majesty, as a virologist, how effective do you think the current vaccines are? The current vaccines we have in the market. How effective are they? And as a traditional ruler, would you encourage your people in your community to go for vaccination?
Yes, first of all, I believe that question should also be thrown at Dr. Hoda that has received it. I've not received it, but talking from the point of being a scientist also, I would say based on the process of production of vaccines, the quality control and everything, the steps the vaccine goes through before it is approved, I would say it is something that is dependable. And the only thing that cannot be known right now is how long the immunity it gives could last, the years it could take. But for it to be approved by the government, by the control agencies, and even the pharmaceutical companies themselves, it must have gone through the right medium of production and distribution. Then, number two, as a community leader, I would freely advise my people to receive the vaccine. The vaccine is not harmful, although there can be little side effects, but these side effects can't be compared to the complication that may arise if there was no vaccine at all. So it's something I would advise my people, and I would advise all community heads, not just in Nigeria, but all over the world, all community heads, politicians, legislators, those that are in the parliament, that they should encourage their people to receive this vaccine. It is a lifesaver, and it's really going to help heal the world.
Thank you very much, Your Majesty. I now open the floor to everyone from our audience to throw your question to a specific person. I see two questions from Mr. Ivan from Uganda. Thank you, Mr. Ivan from Uganda. You can ask your two questions now, please, Ivan. Or do you want me to just read them out? Okay, I'll read Ivan's question. Anybody on the panel can take it. How do we hold big pharmaceutical companies accountable and get them to provide vaccine patents to countries to allow fears on the treatment formula, but also allow for mass production? Any of the panelists can take that. And then the second question is directly to Guruji. Guruji is asking about alternative medicine. Is it possible to get this approved as a treatment for the case where countries can't afford the vaccine? And what are the modalities? So let's start with these two questions. If you have any question, you can leave it in the chat room, or you just raise your hand and I will unmute you to ask a question.
The answer I already gave. I said Ayush department, they can contact them, or ABC Homeo, it is there. And any naturopathic website, because they all talk about immunity boost. They're not thinking about how to treat people. That is not our job. And we already mentioned about yoga and all other practices. And doctors, they have their duties. And very clearly said, everything should go hand in hand. Science and spirituality has to go hand in hand. Naturopathy, whatever it is. and UN is here to supervise everything. All the vaccines they are supervising. They are observing all the records and everything. For mass production, we need a global community to come together and easy to make vaccines within 1 month. But so much drama going on, political dramas. That has to be stopped 70 years back. So I'll suggest to the youth, Khadija already mentioned 40% of the people are youth. My request to the entire world, youth should stand up and ask them, stop all the war, spending money for unnecessary stuff. Do not use any chemical weapons or experience with the unnecessary bio, genetic items. Just support people to sustain education, taking care of people's life. We have so much money already here. We are wasting money. That's the thing I see. So let us see.
All right. Thank you very much, Guruji. Dr. Garima, do you want to take the question on Big Pharma and then maybe Dr. Martin, and then we'll move on to other questions?
That is a very, very difficult question to answer. But yes, the thing is that uh, I did some research about it, and I feel that right now there are around 200 players in the market who are actually trying to do the mass production. I feel that some things are not in the hands of a common citizen. But then my appeal to the people, especially who belong to a democratic country, would be that yes, we must definitely raise a voice, and we should convey it to our respective governments. That we need the vaccine. So first and foremost, I again would say that first we have to believe in the vaccine. First, we have to believe in the process of vaccine. And I feel that if a country like the United States of America, where so many cases, so many deaths, so many positive cases per day are still happening, and there is so much of divided opinion about the vaccine. They had trust issues on wearing a mask. They at some point they even used to feel that the virus does not exist. So I really feel that, instead of wasting our times in these beliefs that whether virus exists or not, we have seen the pandemic, and it is, I think, high time. So I feel that once everyone wants to take a vaccine, I think the governments would have no other option but to procure them, or focus on the mass production. I feel that each and every country would want their economy to not get affected. I think most important thing any particular government thinks is that they should actually prove during their tenure that their economy was successful. So I really feel that once everyone wants to take a vaccine, that would be first stepping stone. And I really feel that, like, I think from my country, India, we have supplied vaccine to many neighboring countries and to some of the European countries also. Like India gave free vaccine to Nepal, to Bhutan, to other neighboring countries, and we have given free vaccines to some of the European nations also. So similarly, if other players could come forward and supply vaccines to the continents of Africa, to other places where we are facing these problems, and keep aside the political barriers between, I think that would be the game changer. So I really feel that youth definitely can do something about it, but beyond the point, no one can do something about the political thing. So I would say that let politics be kept aside, and what we can do, yes, we can raise our voice, we can actually educate our fellow citizens, and we could educate people that yes, vaccine is a positive thing. So first is self belief, and second is making people believe that vaccine is required. So I feel that sooner or later vaccines definitely would be mass produced, because if you look at the business point of view also, the pharma companies who have already got the patent and have already started the production would definitely want to make more business out of it. So I feel that it is just time, and I really feel that now that if first and foremost the front health workers, the frontliners, then the senior citizens, and then the youth would keep on getting vaccinated, then I feel that there in no time, let's say by April or something, I'm really hopeful that it would be sufficiently available across the globe, because there are around 200 more companies which are actually trying to manufacture and produce the vaccines. Thank you so much.
Thank you very much. Thank you very much, Dr. Garima. We are out of time, so I will quickly take maybe one or two questions from the audience, and then we'll have a final thought from all of our panelists, and we'll call it a day. Do we have any question from anyone in the audience? I don't see any hands up. Do you have any question from anyone in the audience or the GNSD team? Does any one of you have a question? Okay, I don't see anyone unmuting themselves to ask a question. So I'll quickly give our panelists each 1 minute, in 1 minute, to give us your concluding thought and final words as we close this discussion today. Let me start with Maria Highness, the concluding thought, and then we would have Dr. Martin next, and then Khadija, and then would have Guruji, and then Dr. Garima would give a final thoughts. Your Majesty?
Yeah, it's been an amazing discussion and very interesting one, and I appreciate the thoughts and ideas, opinions of our panelists, of my fellow panelists here. I believe one step at a time, we are making steps to impact positively on the world around us. And I believe we'll get there. This time next year, I hope we won't still be talking about vaccines, because at the end of the day, everyone should have received it, if not at least a greater population of the world, a greater percentage should have received the vaccines. I appreciate it's an opportunity and privilege to be here. So thank you very much.
Thank you very much, Your Majesty. Dr. Martin?
So I think COVID has exposed the realities that we need to build internal capacity for resilient systems than dependence. So I would like to see intentionality by our own governments having citizen-centric leadership and approach to doing things to build the infrastructure that will support us in the event that we have another pandemic like this. The only way you can break the habit of monopoly by big pharma is collaboratively among its countries, building each other's internal systems and sharing resources, such that we do not have to rely on the multinational companies, which currently are making a killing out of the pandemic. So I hope this has been an expose to global governance and also local governments, such that we can be more intentional in building a sustainable and citizen-focused infrastructure to be able to be resilient and respond to all these challenges as they will be coming up. Thank you.
Thank you very much, Dr. Martin. Khadija?
Well, thank you all so much for the rich interventions. I learned so many things from you, not only scientifically speaking, but also how we share many challenges, although we live in different countries, how human beings eventually share commonalities despite the distance between us. And something that I would like to add to how young people can support is also to build this sense of sympathy and empathy towards others who are not able to understand the importance of vaccine, and to understand the roots of these misunderstandings of what a vaccine is and what its purpose is. Something that I would like to call upon is for governments to provide more resources for young people to have this capacity to lead initiatives, to have trust in them to lead these initiatives, and to congratulate them for any progress they make while implementing local initiatives in their countries. Because young people indeed represents the future. And thank you all. That's the simple thing that I would like to say
Thank
is
you. Thank
thank
you
you for
very much,
all your
Khadija.
efforts. And yeah.
Thank you. Thank you very much for that intervention. Guruji, sir, in 1 minute, please.
I learned something. Yeah, I learned something from this situation. World is growing. We all have responsibility to help each other and care each other. I hope UN will open up for everybody and implement everything equally for everyone. Thank you.
Thank you very much, Guruji. And finally, but not least, Dr. Garima, your concluding remarks.
Thank you so much for this enriching panel discussion. I really learned a lot. And the most important takeaway point from everyone's discussion over here, which I learned, yeah, which got re-imbibed in my mind, is that yes, we have to, there should be equality, across the globe, and everyone should get access. I would suggest that yes, have trust in the vaccine, and yes, even after the vaccine, please keep on following the all the protective measures, because we have to together take a stand.
Thank you very much, Dr. Garima. Thank you very much, all my panelists. I appreciate you all. I will now hand over to Dr. Ashima to give us the vote of thanks and closing remarks. Dr. Ashima?
Stephen, sorry to interrupt. Stephen, can you hear me?
Yes, I can hear you, Anushri.
Stephen, can you hear me?
Yes, I can hear you, Anushri. Go ahead, Anushri.
Yeah, I was just wondering if you have logged in from the laptop, can you click a group picture? Yeah. Yeah, can you please click a picture for all of us together? And everybody, I would just request you to please switch on your webcams so that, and smile for a photograph, which Stephen can click because he's logging in from a laptop. Yeah.
Is everyone okay with us taking a group picture? If you're not okay with us, please just let us know. We would not share this. Is it okay with everyone? Do we have your permission to do this? All right, I don't see any objections, so I'm going to take it now. Thank you very much, everyone. I've taken a picture. Thank you. All right, Dr. Ashima, over to you.
Oh, thank you. Thank you. Okay. Thank you so much. I think that it was a wonderful discussion. It was very enlightening. On personally, for myself, I mean, everybody is having it. I mean, I want to take it, but then I have a slight hesitation. I feel that this discussion was good and helped me out a lot of that. Thank you to all the participants who were part of the panel, or who attended it. I would like to thank each one of you for taking out your valuable time and being part of this discussion. A big thank you to all the panelists for joining and sharing your views and enlightening us with your point of views and your suggestions. I believe each one of us will be following some part of your advice, if not all. But yeah, thank you so much for that. Uh, Thank you, Dr. Martin Balba, Miss Khadia. Sorry if I apologize for not pronouncing the names well. Miss Khadia Amahal, Her Highness Princess Falova, Dr. Garima Podar, and Guruji Dilip Kumar. Thank you so much for joining us. I would also like to thank Dr. Sapna Nerula for guiding us and bringing us all together for this discussion and for guiding us throughout in GNSD. And to all my colleagues who have been working hard, not only for this discussion, but for all the wonderful panel discussions we've been having over a period of time. Stephen, thank you very much for bringing up this topic, and I feel this was very much relevant and need of our. Uh, in the end, I would just like to, say that let's stay connected because together we can achieve a lot and make this world a better, happy place. So, GNSD is a network and we try to connect people. We are all together. We have some, sustainable development goals and is bringing us all together. That is what my thought is. And let's be connected. Thank you so much for joining in. Thank you. Have a great day. Yeah. Bye bye.
Thank you very much, Dr. Shima. Have a
Thank
great
you.
day, everyone. Bye-bye.